So, hello student, very good morning to everyone. And in the last lecture, we have finished unit 1, and so today we are going to start new unit, that is unit 2nd. And in that unit 2nd, we are going to start the new chapter, that is chapter number 2.1.1, analgesic and antipyretic drugs. So, so before starting that, uh, the, the topic, this is the topic that we had learned in the last lecture, that is asymmetric synthesis of amphetamine. So the synthesis of this amphetamine start with your phenylacetone in presence of this chirolamine. When this chirolamine heated, so formation of chip base takes place, then the reduction of the chip base, you will get this compound. Then simply the hydrogenolysis reaction, you will get the 10%, 100% in enantiomeric excess amphetamine. So this is the topic that we had covered in the last lecture. Now today I'm going to start this new chapter, that is analgesic and antipyretic drugs. So what is analgesic drug? So analgesics are the selective central nervous system depressant. These are the selective central nervous system depressant which brings about insensibility to pain without loss of consciousness. Without loss of consciousness, that is called as analgesic drug. So analgesic drugs, these are the selective CNS depressant which brings about insensibility to pain without loss of consciousness, that is called as analgesic drugs. And the second one is your antipyretic drug. So antipyretic drug, antipyretic is a drug which is responsible for lowering temperature. It is responsible for lowering the temperature of a human being or animal having fever to normal, but has no effect on normal temperature state. Normal temperature state. So this antipyretic is a drug which is responsible for lowering temperature. It lowers the temperature of a human being or an animal having fever to normal, but has no effect on normal temperature state, that is called as antipyretic drug. So this is the definition of antipyretic drug, and this is the definition of your analgesic drug. So analgesics are the selective central nervous system depressant which brings about insensibility to pain without loss of consciousness, that is called as analgesic drug. And an antipyretic is a drug which is responsible for lowering temperature of a human being or animal having fever to normal, but has no effect on uh, normal temperature state. So it lowers the temperature, lowering the temperature of human being having fever to normal. So if the person having fever, so it lowers the temperature and it normalize the temperature, but that drug, this antibiotic drug, has no effect on normal temperature state. So this is about a definition of your analgesic and antipyretic drugs. So in the next slide, this on the basis of analgesic potency, on the basis of analgesic potency and the difference in the dependence in the body develop in the development of dependence and tolerance, analgesics are commonly divided into two classes. So on the basis of analgesic potency and the difference in the development of dependence and tolerance, analgesics are commonly divided into two types, that is uh, its potency and the difference in the development of dependence and the tolerance of that analgesics. So these analgesics are classified into two types, that is analgesic and non-narcotics. So What is narcotics? So is narcotics which strongly acts on CNS. Narcotics, these are the drugs which strongly act on CNS. CNS means central nervous system. That drug is called as narcotics. And the non-narcotics are which mildly act on PNS, that is peripheral nervous system, that is called as non-narcotics drugs. So the narcotics which strongly acts on CNS, central nervous system, and non-narcotics, these are the drugs which acts mildly acts on PNS, peripheral nervous system. So we'll see this narcosis. What is meant by narcosis? So it can be defined as unconsciousness produced by a drug. Narcosis is defined as unconsciousness produced by a drug, that is called as narcosis. So narcotics are the drugs which induce abnormally deep sleep. It produces deep sleep and produce increased tolerance to pain. It increases the tolerance to pain, lessen the perception for external stimuli and feeling of well-being, that is called as euphoria. So this narcotics, it can be defined as the unconsciousness produced by a drug. Narcotics, these are the drugs which induce abnormally deep sleep and produce increased tolerance to pain, lessen perception for external stimuli and feeling of well-being, that is called as euphoria. So narcotic analgesics causes respiratory depression and cerebral vasodilation in CNS. So narcotic analgesics causes respiratory depression and cerebral vasodilation in CNS. The cessation of respiration or the stop of respiration is the cause of death in narcotic poisoning. So this is the main cause of death in narcotic poisoning, that is cessation of respiration or the stop of respiration is the main cause of death in narcotic analgesics. So the prolonged administration of the drug can produce tolerance and psychic and physical dependence called as addiction. So after prolonged administration of this drug can produce tolerance and psychic and physical dependence called as addiction. And due to their high analgesic action, due to the high analgesic action of this narcotics, they are also called as narcotic analgesic. They are also called as narcotic analgesics. So what happened after the discontinuation of a drug? The what happened? The body cell readjusts to the absence of the drug unnoticeably. In some cases, what happened after the drug withdrawal, a psychic craving for the drug is observed. A psychic craving for the drug is observed, which lead to physical disturbances, and that syndrome is called as addiction. Certain drugs, for example, morphine and your heroin, cocaine, and certain barbiturates are known to be cause addiction. So we'll see in the detail, that is narcotic analgesics and narcosis. So first one is, we'll see this narcotic analgesic. So what is this narcotic analgesic? So the analgesic drugs act in a various ways on peripheral and central nervous system. So analgesics, these are the drugs which act in a various ways on peripheral and central nervous system. Analgesics or a painkiller is a member of group of a drug to achieve analgesia. To achieve analgesia. So you know that this your analgesia, the term analgesia comes from Greek word which means without pain, and it is also called as painkiller. The term analgesia comes from Greek word meaning without pain. So this analgesic or a painkiller is a member of a group of a drug and used to achieve analgesia or relief from a pain. For example, the paracetamol and some NSAID drug, that is non-steroidal anti-inflammatory drug. So an antipyretic is a substance that reduce fever. So antipyretic is a drug that reduce fever. uh, so what this narcotic are the drug that produces analgesic. The narcotics are the drug that produces analgesic, that is pain relief. It gives the relief from the pain. In some people, the narcotic produces feeling of well-being, that is called as euphoria. The main therapeutic use of narcotic is for pain relief. The main therapeutic use of narcotics is it is used for pain relief, and hence they are called as narcotic analgesics. So due to its high analgesic activity, it is also called as narcotic analgesic. The best known narcotics are opiates. The best known narcotics are called as opiates. So it derived from opium. So opium is the dried milky exudate. So opium is a dried milky exudate of unripe seed capsule of species of the plant called as Papaver somniferum. So opium is the dried milky exudate of unripe seed capsule of species of plant Papaver somniferum. The opium alkaloid, it contains 20% by weight of opium, and their derivative are narco analgesics. So this its derivative also contain this opium. This milky exudate contain other derivative, and that are narco analgesics. So this the opium alkaloid exists in a two distinct structural classes. So that is your phenanthrene. So this opium alkaloids, it is alkaloid, and it exists in a two distinct structural classes, that is phenanthrene. So under the class of phenanthrene, morphine, codeine, and thebaine. So these are the class comes under this phenanthrene. These are the example comes under this phenanthrene. And the second class is benzyl isophenyl. So under the benzyl isophenyl, papaverine, nascapine. So these are the example under this benzyl isophenyl. So this that the compound derived from opium, the compound that is derived from opium is called as opiate. So this opium is the dried milky juice seed of your Papaver somniferum, and along with that it also contains 20 or more alkali are found in that opium. The most important one are morphine. The most important one is morphine, as we had already told you that morphine, thebaine, codeine, uh, uh, these are the class of that phenanthrene. So the most important one is your morphine, which is primarily responsible for opium narcotics. So this morphine is primarily responsible for opium narcotics properties. Drug with action to the drug with action similar to morphine that are produced synthetically are known as opioids. So the drug which have similar action to morphine and that produced synthetically, that is called as opioids. And the term opiate, opioid, and narcotics are used interchangeably. So the term opiate, opioid, and your narcotics are, these are the terms which are used interchangeably. So in most of the countries, the production, the trade in, and the use of narcotics are limited because of their addictive properties. So it causes addiction. So in most of the countries, the production, trade in, and the use of narcotics are limited because of their additive properties, because of their addictive properties. So this morphine uh, having this narcotics having addictive properties. So in some countries the production trading are limited. So and due to its detrimental effect and incidence of narcotic drug abuse. So because of this reason, that is the addictive properties, detrimental effect, and your incidence of narcotic drug abuse. So due to this reason, the production and trading is limited in some countries. The extract of opium were smoked, eaten, or drink. The extract of opium were smoked, eaten, or drink. The invention of hypodermic needle in the mid of 19th century allowed the morphine to be administered by injection, which is useful in medicine because injection of morphine produces much more greater effect than taking the same drug, same amount of drug by oral route or orally. So the invention of hypodermic needle in the mid of 19th century allowed the morphine to be administered by injection, and which is useful in medicine because injection of morphine produces more or a greater effect than taking the same amount of drug orally. However, the availability of morphine injection led to serious problem of abuse, and the laws were introduced. So due to this abuse, serious problem abuse, the laws were introduced to control the use and production and the trade of narcotics and other dangerous drugs. So in 1998, the heroin. In 1998, the heroin. In 1898, the heroin, and that is diacetyl morphine. Heroin is nothing but it is a derivative of morphine. That is diacetyl morphine was developed from morphine. It is developed from morphine by the company in Germany. So this heroin is developed in 1898 as diacetyl morphine from morphine by the company in Germany. It is developed in Germany. So heroin is heroin is 5 to 10% more potent. So heroin is 5 to 10% more potent than morphine, and it's morphine itself. So heroin is more 5 to 10% more potent than morphine itself, and it is used by most of the narcotic drug addict. So it is used by the most of the narcotic drug addict. So this is the seed of that Papaver somniferum, dried milky exudate, and this is the general class of phenanthrene. This is your phenanthrene general structure, and if this Rn R dash, if this Rn R dash is equal to hydrogen, if this H is equal to hydroxy, H is equal to hydrogen, then it become hydroxy group. That structure is called as morphine, and that structure will become morphine. I think you're in in your Kabir Singh movie, you have seen that Shahid Kapoor is taking that morphine by intravenous route. So, so this is the when you replace the hydrogen of this, when you replace the R group by hydrogen, it will become morphine. Then if you replace this R with COCH3 acetyl group, diacetyl morphine, that is called as heroin. And if this R, one R becomes CH3, if you replace one R by CH3 and one R by H, that is called as codeine. And so these are the images of that heroin, morphine, and this is the seed of that Papaver somniferum, from which this different derivative has been extracted from that milky exudate, and it contains more than 20 alkaloids, and among that this morphine is the primarily morphine having strong narcotic analgesic activity. So the uses of this morphine are: morphine is a potent narcotic analgesic, and it relieves all type of severe pain caused by serious injury, neoplasm, migraine, pleurisy, biliary, and renal colic. So the morphine is a potent narcotic analgesic, and it relieves all type of severe pain caused by serious injury, neoplasm, migraine, pleurisy, biliary, and renal your renal colic. So these are the uses of this in serious injury, neoplasm, then migraine, pleurisy, biliary, and renal colic, and it is also administered as a pre-operative sedative. It is also administered as a pre-operative uh, sedative. So before the operation, so a drug that reduces the excitation and calms the person. So this morphine or this uh, morphine has been used as a pre-operative sedative. Then it is a habit forming and hence should be given only when the pain relief drugs are not adequate. So here the one mistake is there, that is it is it is a habit forming and hence should be only given when other drugs when other pain relieving drugs are proved to inadequate. So proved to be inadequate. So here the one mistake is there, one other drugs are proved to be inadequate. So it is a habit forming and hence should be given only when other pain relieving drugs prove to be inadequate. So this is all about Phenanthrene class, and we have learned the uses of this morphine. So this is the general structure of Phenanthrene. When this R is replaced by H, the structure will become morphine. When you replace R by acetyl group, that is heroin 5 to 10% more potent than this morphine. Then if you replace this R by Aspirin H, it will become your Phenanthrene. Then the next point is non-narcotics. So this non-narcotics analgesic is a group of uh, drug that relieves pain without interacting with opioid receptor. They possess anti-inflammatory property, and that's why it is also called as NSAID drug. That is non-steroidal anti-inflammatory drug. Anti-inflammatory drug. So this possesses anti-inflammatory property and are also known as non-steroidal anti-inflammatory property. Further they reduce the elevated body temperature. So further these drugs reduce the elevated body temperature, that is antipyretic effect, and that they are non-addictive. So this NSAID, they are non-addictive like your morphine, thebaine, and heroin. They are not addictive in a doses and required to produce analgesia. It required to produce analgesia. So this it also acts as antipyretic drug. So you know that an antipyretic is a substance that reduce fever. The antipyretic cause the hypothalamus. The antipyretic cause the hypothalamus to override the prostaglandin and induce increase in a temperature. The body then works to lower the temperature, which result in reduction of fever. For example, ibuprofen and your aspirin. These are the NSAID drugs, and which are non-addictive and which produces analgesia. So the non-narcotics are classified on the basis of their chemical structure. So these non-narcotic drugs are classified on the basis of their chemical structure into these uh, 8 classes. The first one is cyclohexanol derivative. Cyclohexanol derivative. Example is tramadol. Then second one is your salicylate and their derivatives. Example is aspirin. Then para-aminophenol derivative. Example is paracetamol and phenacetin. Then fourth one is your pyrazolone derivative. Example is phenylbutazone. Fifth one is phenyl acetic acid derivative. Example is diclofenac. Then the sixth one is indole derivative. Example is indomethacin. Seventh one is propionic acid derivative. Example ibuprofen, phenamates, mefanic acid. So these non-narcotics divided into 8 classes depending upon its chemical structure. First one is cyclohexanol derivative. Example tramadol, salicylate and their congeners or derivative. Example aspirin, para-aminophenol derivative. Example is your paracetamol and phenanthrene. Then pyrazolone derivative. Example is phenylbutazone, phenylacetic acid derivative. Example diclofenac. Indole derivative. Example is indomethacin. Propionic acid derivative. Example is ibuprofen. And then eighth one is your phenamates. Example is mefanic acid. So these are the different the classes of this non-narcotics drugs. Then so the we'll see only 3 of this. So under the class of cyclohexanol we'll see this tramadol. So this is the structure of tramadol. It is a 2-ring joined with the single bond, and this is the structure of this your tramadol. So this tramadol, these are the recent drugs and used as an analgesic. So these are the recent drugs used as analgesics, and which is a derivative of cyclohexanol. So this is your cyclohexanol, so it is a derivative of cyclohexanol, and they produce analgesic action similar to opiates, and it produces analgesic action similar to opiates without causing your without causing the sedation, without causing sedation. And so this your cyclohexanol, it is formed as a mixture of cis and trans, and the trans isomer is actually more analgesic than cis one. So 1,2 equatorial it's a trans, and 1,2 axial equatorial it's a cis. So trans one is actually analgesic action than the cis one. So the uses of tramadol is, the tramadol is a potent analgesic used in case of severe physical pain similar to opiates. So this is about cyclohexanol derivative. Under the cyclohexanol derivative we have taken the example that is the tramadol. So this tramadol, so these are the recent drugs of analgesic which is used in the current time, and it produces analgesic action similar to opiates. So it is formed as a mixture of cis and trans, but the trans isomer actually has analgesic action than the cis one. Then next slide. So the second the class is salicylate, and the example under this salicylate is salicylic acid. Example is aspirin, and the general name is salicylic acid. I'm sorry, it's a aspirin. Second class is salicylate. The example is aspirin. That's the derivative of salicylic acid. The example under that derivative is aspirin. So this is the structure of that aspirin. So this aspirin, where these are the aspirin. This is the structure of aspirin, and the salicylate were among the first analgesic to get the recognition, and this it was introduced in the medicine by Dreser in 1899. It is a white crystalline powder. So this aspirin is a white crystalline powder, slightly soluble in water. It is a white crystalline powder, slightly soluble in water, but soluble in alcohol, chloroform and ether. But it is soluble in chloroform, ether and alcohol. Stable in a dry air. It's stable in a dry air, but in presence of moisture it hydrolyzes into acetic acid and salicylic acid. So it's stable in a dry air, but in presence of moisture it breaks, the bond breaks from here, it converts to salicylic acid and your acetic acid. And then the next point is the uses of this your aspirin. So it is used as an antipyretic and anti-inflammatory and analgesic in a variety of conditions ranging from headache, discomfort, and fever associated with common cold, muscle pain, and it is excellent antipyretic due to its high degree of effectiveness and a wide safety margin. So the uses it is antipyretic, anti-inflammatory, analgesic, and it is used in a variety of conditions ranging from what headache, discomfort, fever associated with common cold, pain, and it is excellent antipyretic due to its high degree of effectiveness. It excellent due to its high degree of effectiveness and wide safety margin. Then the next uses as aspirin inhibit the platelet function. It has been employed prophylactically to minimize the incidence of myocardial infarction and transient ischemic attack. It is used in, it has a very good action, that is it used to minimize the myocardial infarction and transient attack. These are the uses of this your aspirin. So it used in the heart related problem. The next slide is your para-aminophenol derivative. Para-aminophenol derivative. So this para-aminophenol derivative, under the class of para-aminophenol derivative, we are going to take the example of your paracetamol. So this is the structure of paracetamol. It having hydroxy group at para position and then NH3 double bond of CH3. So this they are also known as coal tar analgesics. This para-aminophenol derivative is also known as coal tar analgesics. They are derived from aniline, because they are derived from aniline. If you break this bond, so you will get the aniline. So it is derived from aniline. And among the isomer of para-aminophenol, the para isomer is found to be less toxic. So it having ortho meta in para, but here it has been found that the para isomer is less toxic as compared to ortho and meta. So the uses of this your paracetamol is, it is a metabolite of phenacetin. It is a metabolite of phenacetin and acetaldehyde, and used in as an antipyretic and analgesic. It may be used effectively in a broad spectrum of arthritic and rheumatic condition linked with musculoskeletal pain, headache, neuralgia, myalgia, then this dysmenorrhea, dysmenorrhea. So it is used in the variety of condition, that is arthritic, rheumatic condition linked with musculoskeletal pain, headache, the different this type of diseases, and it is particularly effective in aspirin sensitive patients, and it is particularly used in a aspirin sensitive patient which has a sensitive which is the person which is sensitive to aspirin. That time we are using this your paracetamol. This is all about classes. So this non-narcotic drug has been classified into 8 classes, that is cyclohexanol derivative, and this non-narcotic is also called as NSAID drug, that is non-narcotic non-steroidal anti-inflammatory drugs, and it relieves all types of pain without interacting with opioid receptor, and it also possesses anti-inflammatory activity or anti-inflammatory property, and they are also known as non-steroidal anti-inflammatory drugs, that is NSAID drugs. And further, they reduce elevated body temperature. It reduces the elevated body temperature, that is antipyretic effect, and uh, they are non-addictive. The main important thing is they are non-addictive, while the your your narcotics are addictive in nature, but this non-narcotics, they are not addictive in and they are also produce analgesia like opiates. This non-narcotics are classified on the basis of their chemical structure. We classify into 8 types, that is cyclohexanol derivative, salicylate and their congeners, then para-aminophenol derivative, pyrazolone derivative, phenyl acetic acid derivative, indole derivative, then propionic acid derivative, phenamates. Then we'll see this three, that is tramadol. The example of cyclohexanol structure of this, it's a cyclohexanol derivative. It exists in a two. It exists in a mixture, that is trans and cis. So a trans is found to be analgesic, and it is a potent analgesic used in the severe physical pain. It's aspirin. So you know that this aspirin, it is a class of salicylate, and salicylate were the among the first analgesic to get the recognition, and it was introduced by the scientist. And then the name of that scientist is Dreser in 1899, and it is white soluble, white crystalline, slightly soluble in water, and but soluble in ethanol, chloroform, and ether, and stable. It is stable in a dry air, but in presence of moisture it hydrolyzes into acetic acid and your salicylic acid. And the uses of this aspirin is, it is used used as an antipyretic, anti-inflammatory, and analgesic, and in variety of condition ranging from headache, discomfort, fever associated with the common cold, muscle pain. And it is excellent antibiotic drug due to its high degree of effectiveness and wide safety margin. Then it the this this aspirin also used in the heart related problems. The next one is your paracetamol, which is a derivative of para-aminophenol, and this para-aminophenol are also known as coal tar analgesics, as they are derived from aniline, and among the isomer of among the isomer of aminophenols, the para isomer is found to be less toxic, while methane also are more toxic. So this para isomer found to be less toxic, and it is a and this paraminophenol, it is a metabolite of phenacetin and acetonide. It is a metabolite of phenacetin and acetonide, and it is used as an antipyretic and analgesic. So it may be effectively used in broad spectrum of arthritic and rheumatic condition linked with musculoskeletal pain, headache. Then it is particularly useful uh, in aspirin sensitive patient. And thank you.